Hello, everyone. Welcome to our episode today. We are recording episode 21. And today I have with me an amazing person, Dr. Gladstone. He's my first guest from Ghana, so I'm super excited to have him. I mean, this is the first time I'm having a session with a Ghanaian, so it's super exciting. So to be nice to also hear what is happening in the digital space and health tech space in Ghana. So I'll quickly read your bio. And then after that, I'll go through some of the questions. We're going to hear more of your experience and also hear about even the healthcare system in Ghana just to learn. Yeah. Welcome. So yeah,
Sure,
Dr.
sure. All right.
Dr. Gladstone Elikemdo is a dedicated, experienced physician assistant with a master's degree in public health. He brings together his experience in clinical setting, digital technology, with a lot of digital health solutions, and he has participated in a lot of impactful public health initiatives. So most of your work, when I read through your profile, are in the telemedicine space, and you are currently at Berry Health. And you've also worked as a physician assistant again at Sanford Health Institute. So you also tell us more about that as well. And then you've done some research, which is another thing I want to hear more about. You've done research on the post-flood health risks and healthcare accessibility in Ghana. So we'll talk about healthcare access in Ghana. And then lastly, we're also going to talk about the publication you did on telemedicine and health and M-health in rural African primary healthcare. So yeah, amazing experience ahead of us. So now let's hear
Yes.
about your story.
Thank you so much.
How did you come into
Yeah.
medicine and then this tech space? Just a little bit more about you.
All right. Thank you so much, Gabriel. And I'm excited to be with you on your podcast, Medics and Health Tech. Just a few corrections. I'm not yet a doctor. I'm
Oh,
still
really?
Gladstone Elikam, though.
Oh, nice.
Yes. In Ghana, physician assistants don't carry
Oh,
the title doctor.
oh,
Yes.
oh, nice.
That is reserved for the medical doctors or the academic doctors. Yeah. So, as you are aware in my profile, I'm a physician assistant, medical. I'm specialized in the medical field of physician assistants, and I've been practicing for a little over 8 years now. And our practice as physician assistants in Ghana basically is in primary health care. So, in primary health care in Ghana, you are more of engaged in the community. So, you have your medical practices more engraved in uh, community health than specialized care. So, in my practice as physician assistants, I get reached, and this kind of spurred the interest and the desire in public health. So, venturing into public health actually opened up big perspectives for me. It's like it gave me a deeper understanding of how far we can take healthcare, how individual management of cases in the hospital may not be enough to build a health system. We need public health in order to strengthen our health system. So, briefly, that has been my journey from public health, from physician assistantship to public health. And this has really opened up doors for me. You already know
Yeah.
in telemedicine and all not. Yes,
Mm.
yes.
So now let's talk about your current work in telemedicine. So what are you currently doing with Berry Health?
Okay. So my position and role in telemedicine, or let's say digital health at Berry Health, is fairly new, and it's an exciting field. I'm really excited about. For my role at Berry Health, we usually see people using telemedicine. So, like what we are doing now, you tell me what your complaints are, what you are feeling. It's kind of the consulting room on the internet or over a video call. Yes. So as interesting that is, as much as interesting it is, and as exciting it is, and far-reaching as it can be, it has its limitations. It has its limitations. Uh, I know we'll talk about the limitations later, but let me talk about the exciting part of the telemedicine now. So we are able to reach more people. People can seek or speak to a medical professional during their break time at work, have their medications delivered to them in few minutes, even before their break time is over. So that is the wonders telemedicine is doing. And in Ghana, we have few companies or government is really not into telemedicine as of now. So Berry Health is kind of bridging the gap a lot, even in the urban areas. Usually, most of our clients at Berry Health are from the urban and the peri-urban areas. We are yet to infiltrate the rural areas. That is one thing that really informed my article on whether the buzz about digital health is really reaching the rural that really are marginalized in terms of healthcare equity. So my work at Berry Health is basically consulting room over a video call, makes us reach you faster in your own convenience. You have access to a medical professional and your medications get delivered. Yeah.
Okay, thank you so much for the breakdown. So now, how did you get to be a telemedicine physician assistant? So was it that you were trained? Were you taken to a school? So what was the process that was involved in making you suitable for this role?
Okay, so if I get your question right, is there processes involved or how I became a physician assistant and later probably joining
Yeah.
digital health or
Yeah,
telemedicine,
how you
right?
were are you able to
Okay,
are you able to adapt to the telemedicine? Was it that you were trained? Were you taken through some trainings? Just to understand that it wasn't that they just brought the telemedicine to you and then you started. So what really happened?
okay, of course, yes. So um, my way through physician assistantship to telemedicine, it's kind of I would say that my further education in public health was what brought me to telemedicine or digital health in the first place. Working as a physician, I have basic knowledge on digital health and telemedicine. Even though at my clinical workplace, that's Sanford Health, we use electronic patient management systems and all that, but not one that can really communicate with the patient and see the patient via video call. So during my studies, during my MPH studies, a colleague of mine had to do for his thesis work a systematic review of digital health in Ghana. I got so interested in it and I was with him throughout. We discussed ideas on how the project should go, on things to find out, things to research. And we got to know that even the term digital health is not having a singular definition when we come to the context of Africa or the context of Ghana. He did the review over a decade, 10 years period. So that exposed us to the gaps in digital health or telemedicine and how far as a country we have come. So we did so many seminars on digital health whilst I was doing my MPH. And this gave me more insight into what digital health is, what M health is. I actually wrote quizzes on these topics. So I really got interested. After school, I decided to just research so much about digital health, find out companies and people who are making strides in digital health, find out how or what their impact is and the potential of this impact on patient outcomes and health systems. So me coming across Berry Health was as a result of research and recommendation. So because my interest in digital health was made known to some of my senior colleagues at work, I got the recommendation. And before I started Berry Health, I actually used their system to see how well and efficient it is. And I would say for now, it worked well. And that was what got me really interested and got me to Berry Health. And when I got to Berry Health, I underwent training to use telemedicine. They actually trained me how to use telemedicine, how to even respond to a patient via video call. You may think it's business as usual as the consulting room, but not really. You would need some communication skills. You would need some social skills in order to, probably looking at you via video call, I could be able to elicit some signs and symptoms you may not really tell me upfront. Yes, so I actually went through a localized training at Berry Health to really be, let's say, accustomed to their system. Yes. So for Berry Health, I was trained for their system. But for digital health in general, I got interested due to research and my own interest in digital health. Yeah.
Okay, so let's talk a little bit about what Berry Health system is like. Is it like a mobile app that you now use to record, or you use a video call over a mobile app, or you just use a web app? Like, how does it work? What's the system like?
Okay. So Berry Health telemedicine is like we have a website. So you go to ourberry.com, then you click on book an appointment, or we have a list of conditions. Berry Health started with sexual health and hair and skin. Now we are into general medicine and we are also into specialized medicine. So when you go to ourberry.com, it's a website. So you click on a condition that is closely related to what you are about to report. If you don't find anything you currently have or closely related, you can just move forward straight and book an appointment with a doctor. Then you have your appointment date being sent to you via a chat box, which you also access after you sign in or you register and sign in on the website. So when you do that, we have a list of questionnaires depending on the condition you pick or the complaints you give. So you go through, we ask you basic questions that can give your healthcare provider an idea of your complaints before even your appointment comes. So we have a fair idea of what you are coming to tell us, what your conditions are, and gives us time to prepare well ahead before we have an interview or a consultation with you via the video call. Yeah, so for Berry Health, it's quite easy. You don't need to download an app. You just go to berry.com, click on the condition that is closely related to what you have, or if you feel what you have is not part, you go to the questionnaires, you answer them, book your appointment, and you meet your healthcare provider. Yeah.
So you meet the healthcare provider over the web app, like on the web page, a video call on the web.
Yes, over
Okay.
the web app.
Okay.
Yes,
Okay.
yes.
So the API
Yes.
of the
So
videos.
we have an embedded video
Yeah,
conferencing system.
that's what I want to know. Yeah, that makes sense.
Yes.
That makes sense. So now that really makes sense because that means
Yes.
you are able to, you're not using like an external app, like maybe a Google Meet or something.
Initially, we're using Google Meet, but we now have an embedded video chat that we use. Yeah.
Okay, yeah, that makes sense. So now, what are the feedback you've been getting from patients
Yeah.
using this compared to what they used to use before in terms of going to meet a doctor in the hospital? What are the positive
Yes.
opinions of people about it? And then we'll now go to the negative and the limitations, as you said earlier as well. So let's go about the positive first. What are people saying really
Yeah.
about
Yeah.
the web app?
So for the positives, I would say it's resounding. The positives are so resounding because one, the convenience, and secondly, because we started with sexual health. This is an aspect of health that many struggle to go and meet a medical practitioner in person to discuss. So more people feel so comfortable and convenienced having this online. You can choose not to put your video on, and we can do it with just audio. And they feel so comfortable with that. So, in terms of that, the positives are so resounding. As I said, the convenience and people having to freely speak about their conditions without any fear of judgment from having a physical one-on-one with a healthcare professional. Yes. And the number of people we are reaching keep increasing day by day because the response we get means there is recommendation going on, even among the people we see. So they recommend this to each other about the positives. So it's being convenient. Your medications get delivered to you wherever you want it to get delivered all across the country. So I'll say the major positives are the convenience, having to speak to a medical practitioner without judgment, and having your medications delivered to you with ease within the shortest possible time, wherever you are in the country. Yeah. So those are the major positives we have now. Yes.
That makes sense. But let's talk about the negative as well, because there's nothing with positive without negative. So what are the negative opinion? Maybe not
Of course.
necessarily
Of
so
course.
negative, but
Yes.
what are they?
Yes. So I'll say the downsides of telemedicine, or telemedicine, now that I have experienced practically. First is connectivity issue. Even though every day we make strides in internet access and connectivity, there is still much gap to be bridged. Especially most at time when someone is pitching a digital health or telemedicine, let's say innovation, the first thing that comes out is reaching the marginalized, reaching those in rural areas. But come to think of it, how many in these rural areas can afford a smartphone that supports even our website, or a smartphone that even supports the app, the telemedicine app, or the mHealth app that they have to download? And let's talk about the financial constraints. How many in these rural areas can be able to keep up with the data expenses or airtime expenses that come with internet connectivity? So I would say this is the major downside. Digital health, we always champion it as something that's an innovation that should reach the marginalized and the rural areas. But in actual fact, we are not really grasping that so well. We are not really reaching the marginalized because these socio-cultural factors or socio-economic factors are really preventing those telemedicine is made for from having access to it. Yes. So this is one, or these are some of the reasons that even informed my article, just to have a deep thoughts or conversation about whether we are really meeting our targets. Are we just excited about the innovations, or we are excited that the innovation is actually reaching those it is meant to reach? Yes. So now the major negative side is we are really not meeting or reaching the people we are meant to reach with our telemedicine. Our telemedicine is mostly used by people in urban areas and people in suburban areas. Yeah. So those are the major negative sides of telemedicine.
Thank you so
And
much.
also, um, people are so skeptical about digital health and telemedicine because, as you know, cybersecurity threats, cybersecurity, uh, privacy, people's information, because telemedicine is going to hold somebody's health information online in the clouds. How well are we protecting this? So this is also a major challenge, and it also sometimes deter people from using these services. Yeah.
Okay, thank you so much. So now let's talk about Ghana, because we've not really explored that yet on any of our podcasts. So how is it like in healthcare delivery in Ghana in terms of healthcare access? How you describe the access to healthcare, maybe in the primary sector, the secondary sector, the specialized care as well? You know, how easy it is and how affordable is it, and how wide is it? Like, is it covering everyone? Like, is it enough at the moment? And then after that, you can now talk about how maybe
Okay.
technology is influencing that as well. Thank you.
Yeah. So the Ghanaian health system, I describe the Ghanaian health system as being primary health based. So if you take a look at the structure even of the Ghana Health Service, our health system, the management system, is based on reaching people in rural areas. This is one exciting thing about the Ghanaian health system. Even when you train as a health worker in Ghana, you are being taught how to meet people in the communities, how to reach out to the communities rather than specialized healthcare. We are making strides in specialized healthcare, especially from the government. Um, Government is really making investment in specialized healthcare. We have seen major tertiary hospitals, major investments in specialists coming into the country. The last time, one of the University of Ghana Medical Center made a huge announcement of making successful kidney transplants. This was a celebration in Ghana because people used to travel to India, to South Africa to get kidney transplants. So, in as much as the Ghanaian health system is primary healthcare based, we are now making strides in specialized and tertiary healthcare as well. So, in primary healthcare, the Ghanaian health system has something we call CHIPS compounds. So, this is community-based healthcare systems where we train community health nurses who work hand in hand with midwives that provide community-based care. Basically, this is public health nurses providing prevention advices to communities, providing immunization for children under 5, providing health education for pregnant women. And when you move from there, you go to the health centers. The health centers, yes, that is where you find most at times the physician assistants working hand in hand with the community health nurses and the primary and the midwives. So the physician assistants are described as the first point of contact when you come to the Ghanaian health system in terms of an established healthcare center. So when you go to the health center or health post, you find a physician assistant there. So we are kind of like the first point of contact when it comes to healthcare. From there, from that level, you move to the district healthcare level, where we have an established healthcare facility. It becomes the district level, or the district hospitals become the referral centers for the health centers, the community health posts as well, and the CHIPS compounds as well. Here you find medical doctors together with physician assistants. You find a few specialists here. You can find theaters here performing basic surgeries, cesarean sections, general surgeries, and all that. From here, you move to the regional hospitals, where there is a little bit of, you find more tertiary healthcare facilities there. Then you now move to the teaching hospitals, which are the apex of Ghana's healthcare management. Yes. So the description of the Ghana's health system is, I would say, is mostly primary healthcare based. Ghana have made a lot of strides there. We have the National Healthcare Scheme that gives you an opportunity to have a healthcare insurance card for every Ghanaian.
Wow.
As soon as you are born, you are covered by basic health insurance. As soon as you are born. And it's free for elderly people.
That's nice.
People above the ages of 75.
Nice.
Currently, dialysis, hemodialysis is covered by health insurance,
Wow.
the national health insurance.
Wow. Wow.
So this gives more access to the ordinary Ghanaian, and it improves upon equity in quality healthcare as well. So in Ghana, yes, there are a few challenges, but over the years, we have made a lot of strides in a short period of time. Yes. So for access, there are still limitations, but we are making strides. for competency or availability of healthcare, especially nurses being exported. I wouldn't want to use the word exported, but nurses who are migrating to the to the UK, to the US, to the Canada to get better working conditions. So I think uh, those are, and I think that is generalized to the African health system, the emigration of healthcare workers seeking greener pastures. So for the healthcare system in Ghana, it's basically primary healthcare based. And in terms of equity and access, there's still more to do, but there is strides that are being made daily. Yeah.
Okay, so I have two more questions, and I want us to explore them. So the first question is, what's the current level of use of health technology in the Ghana Health Service at the moment? So maybe, I mean, what are the predominant latest technologies that you can say, okay, in primary healthcare we have this, and it's almost everywhere. In secondary healthcare we have this, and it's almost everywhere. What are those things that you're really proud of? I mean, I'm really impressed with the health insurance, which is very good. I'm really impressed with that. So, I
Yes.
mean, the technology wise too, what are those things that you do have
Okay.
that
So
are quite impressive?
we technology in the Ghana Health Service. Yes, I would say we are still in the foundation stage because as of now, we still, let's say, government health institutions still don't have uh, access to each other using an electronic healthcare system. So the government has initiated that, but it is not yet widespread. So, for instance, when I'm referring a patient from one government hospital to the other, I would still have to write a referral letter on a hard sheet of paper given to the patient or the accompanying healthcare professional to send to the referral hospital. So the government has initiated an electronic healthcare system that will be universal to all government hospitals, but they are still at the foundation stages. And currently, it is just being used in units. So this hospital has its system. The other hospital also has its system. With the integration, we are yet not there. So that about the healthcare management systems. In terms of other digital health technologies we use, uh, Ghana employs zipline technology where we use drones, especially in rural areas, to transport blood products and very vital medications to rural centers where they are needed immediately. And I can confidently say this is still in use because I just experienced one about 2, 3 weeks ago. Yes, when a patient needed an anti-snake venom injection and was not readily available at the CHIPS compound. So they made a request to the district hospital where the center for the zip line is. Within an hour, we had our antivenom serum. So I would say zipline technology is being used. Yes, not in every part of Ghana, but in the very remote places where access is difficult, probably due to bad roads and all that. Zipline works in some extent. Yeah. So in terms of technology in the Ghana health system, we are still at the foundation stages. Yeah.
Thank you so much. Now I know a little bit more about Ghana Health Service. So now let's talk about
Yeah.
professionals that are watching. So a lot of people are quite interested in your career. I know because I mean, as a medical student, you want to make
Yeah.
money on the side and all that, and then you want to also practice, and then you also want to practice not just um any kind of medicine. You want to be in telemedicine because that's the way the world is going. You know, everything is going digital. Tech is going into everything. So
Yes.
even if you're not actively engaged in that area, you still want to be aware of what is going on in that sector of in that part of healthcare. So now, what would be your advice to someone who is, young like you in the healthcare system, still early career, and want to, be able to work in this kind of role? What would be your advice? I know you read books. I can see a lot of books behind you, but yes, apart from reading books, what other things would you recommend?
Yes. Yes. So I've I would say throughout my journey, I didn't know this while starting my journey in healthcare, but I'll say throughout my journey, I have come to realize that to be a young healthcare professional, you really have to have the desire, the passion for what you do. If not, you may just be someone who does a 9 to 5 or an 8 to 2, goes back home and be as miserable as an unemployed person. So the first thing is to have the desire. The desire, whatever desire brings you to healthcare. It could be not direct patient care, be an allied health or an adjunct healthcare provider. It always worked well with desire and it has worked for me. I fell in love with the profession and I am willing to do anything to see my patients go out of the clinic or come out of their homes better off after seeing me. And also, the desire or the passion is to have a better healthcare system because if I help improve the healthcare system, I'm a potential patient. I may also fall sick anytime. And that healthcare system I have helped to build may be of help to me. So, the first and foremost advice I'll give is to develop a strong desire for the healthcare profession. Down here in Africa, especially sub-Saharan Africa, most of us go to work because we need the money. I think a little bit of desire to that will make better professionals because we have the tendency to work hard. We have the tendency to persevere. Yes. So that's the first and foremost. And the second thing I will say is, yes, you get apart from reading and having all the knowledge you can. Yes, you have to because knowledge gives you a lot of power. Yes, knowledge gives you a lot of power. People will need you in their space because of what they think you possess. If they if they think you don't possess what they need, they wouldn't want you close to them. So knowledge also comes in handy. And also healthcare in Africa, as a healthcare provider, let's say in a public health sector, and not as an entrepreneur in the healthcare sector, wouldn't make you a billionaire. You are there to really change your community. You are there to see your brothers and sisters, your cousins, your nephews. You know, Africa, we are all interconnected. You are there to see your chief, your priest, your pastor get well anytime they fall sick. But there is potential in the healthcare in Africa, especially when it comes to do with digital health. Digital health is now coming into Africa, and we can employ this to grant universal access to healthcare. We can look at the entrepreneurial aspects of healthcare, but it shouldn't be at the detriment of the patient. As I said in my article, digital health innovation should be centered around the patient and not the excitement around the innovation, even though the excitement around the innovation is there, but it should be centered around the patient, where at the end of the day, we can boast and say that we left the African healthcare system better off than we met it. Yes.
So that brings us to the end of the recording. Thank you so much for your time. I've learned a lot
Yes.
about the Ghana Health Service and about your role as well, what you do, how telemedicine work. I mean, you'll be surprised that a lot of people don't even know how this thing works. They've just been hearing telemedicine.
Yes.
Yeah, so it's also good to hear
Yeah.
how, how it works from your end. So thank you so much for the opportunity to speak to you. I hope in the nearest future, when you are maybe the director general of who knows, I will get to speak to you again, and hopefully you still want to speak to me.
Thank
So
you so
thank you
much,
so much
bro.
for the opportunity, and I will let you know when
Yeah.
the recording is out. Cheers. Aquaba, right? Is it Aquaba?
All right. All right. Thank you so much, bro.
Right. Cheers.
Aquaba means welcome.
Okay. Thank you then, Aquaba. All right. Bye.
Power means welcome. Yes. Thank you
Uh,
is midasi. Yes. All
Nasi,
right.
yeah?
Okay.
Nasi. Yeah. Cheers.
Midasi.
Midasi. Then, Papa.
All right. Okay.
Cheers.
Okay.
Bye.
Bye.
Yeah, bye.